Hello, my name is Aryahi with Narvekar, and today I'm going to be addressing the healthcare challenges of children with special needs in developing nations. So, like I said, my name is Aryahi with Narvekar, and I'm a rising senior at Montgomery High School in Skillman, New Jersey. Throughout my high school years, I've been deeply involved in debate and model United Nations, but my true passion lies in healthcare. To pursue this interest, I have been an active member of my school's HOSA chapter, participating in numerous health-related competitions and projects. Additionally, I have gained valuable experience working at animal shelters and hospitals in my area, focusing on patient care. At the hospital where I volunteer, I have the opportunity to interact with children and learn more about physical and occupational therapy, the department I work in. My research on spinal muscular atrophy, or SMA, soon to be published, has deepened my understanding of healthcare disparities for children with special needs, emphasizing the necessity for specialized medical care. Imagine the combined population of Europe and North America. That is 1.3 billion people. Now, why am I telling you this figure? Well, I'm telling you because that's the number of people that live with a disability on the planet. This staggering number represents roughly 1 in 6 people in the world. And these individuals not only battle their disabilities, but also face a stark reality. They can die up to 20 years earlier than their peers. And the risk of developing conditions such as depression, asthma, and stroke is more than double. For children with special needs, the situation is even more dire. They often lack access to specialized medical care, which is crucial for their development. To truly understand the impact, let me share a personal experience. Last December, I had the opportunity to visit a school for children with specialized needs in India, where my grandmother volunteers. What I encountered there brought these figures to life in a deeply personal and very unforgettable way. This school is called the Sky Special School, and as I walked in, I was welcomed by a warm and inviting atmosphere. The school has around 30 special needs students, mostly from poor and disadvantaged families, and it's a one-room facility. Despite limited resources, the children were incredibly talented and resilient. A 10-year-old girl, who upon hearing that I loved henna, immediately created a beautiful design on my hands. The school's operation is entirely volunteer-based, with funding mainly from donors. In the words of a teacher at the school, after the students came back from summer vacation, their behavior changed as there was no proper care for them at home. This experience highlighted the urgent need for more support and resources. To help, my brother and I created a website to raise awareness about the school and its mission, as well as attract funding, which has already led to some improvements such as new equipment and consistent transportation. Here are some more pictures of the Sky Special School showing that new equipment. Children with special needs in developing countries face numerous healthcare challenges. They often lack access to specialized medical care and have the risk of developing conditions like depression, asthma, and stroke. Rehabilitation services and assistive devices are scarce, and social stigma hinders their ability to receive the necessary care. These issues highlight the need for comprehensive healthcare solutions to support them. The chart on the right shows the proportions of children aged 5 to 17 years old living in multidimensional poverty, which is defined as experiencing multiple deprivations in areas such as education, health, and living standards. The chart categorizes children by their functional difficulties and signs of anxiety or depression, and it reveals that children with one or more severe functional difficulties face the highest levels of deprivation, with 43% experiencing 3 to 5 deprivations. These findings emphasize the need for comprehensive support systems for children with disabilities. Now we must also recognize the significant impact that mental health has on their well-being. Mental health is a critical issue for children with special needs in developing countries. They experience higher rates of depression and anxiety, often due to a lack of supportive environments and limited access to mental health services. Social stigma and discrimination further exacerbate these challenges, and according to the National Institute of Mental Health, these children are significantly more likely to suffer mental health conditions, yet up to 80% of them do not receive the care that they need. Addressing this issue is essential for their overall well-being and development. In many regions, children face systemic barriers within the medical system itself. The lack of trained healthcare professionals, inadequate healthcare facilities, and insufficient medical supplies are prevalent. According to a report by the World Bank, developing countries have only 2.3 healthcare workers per 1,000 people compared to 12.3 in high-income countries. This severe shortage means that even basic medical needs often go unmet. The lack of investment in healthcare infrastructure further exacerbates these challenges. According to the World Health Organization, the low healthcare spending in regions like the Middle East and North Africa, where only 1.9% of GDP is allocated to healthcare, further underscores the need for increased investment in healthcare infrastructure. Without proper healthcare, these children are often marginalized within their communities, leading to social isolation and decreased quality of life. Addressing these systemic healthcare barriers is crucial to ensuring that all children achieve their full potential. But the challenge does not just stop with systemic barriers. Education is another critical area where these children face significant obstacles. Picture a world where most children with special needs are invisible in classrooms. 90% of them are denied schooling in many developing countries. Education is not just a privilege, it's a fundamental right. When these children are excluded from the classroom, we limit their potential and perpetuate the cycle of poverty. Inclusive education and social integration are crucial for breaking this cycle. For instance, in Burkina Faso, school attendance rates for children with impairments, that is, hearing, speech, mental, visual, and physical impairments, are significantly lower compared to those without impairments, as shown in the graph of school attendance rates for 7 to 12-year-olds and 13 to 16-year-olds. Additionally, Finland's inclusive education system ensures that all children, regardless of their abilities, learn together in the same classroom with individualized support. This approach has led to high educational outcomes and well-being for all students, showcasing the power of inclusive education. So at this point, you're probably asking yourself, what can we do? We can support educations that provide medical care and education for children with special needs, advocate for policy changes that prioritize inclusive healthcare, and raise awareness in our communities about the importance of equitable healthcare for all children. Together, we can work towards creating a more inclusive and equitable healthcare system for all. Throughout this presentation, we've explored the significant challenges faced by children with special needs in developing countries, from healthcare and mental health issues to educational disparities and systemic barriers. We've also discussed actionable steps we can take to make a difference. As we move forward, I want to leave you with a question. How can each and every one of us contribute to creating a more inclusive and supportive world for these children, ensuring that they all have opportunities and care that they need to thrive? Thank you. And here are my references.